Brain is the most important part of our body, and we have our identity because of the brain. When other organs fail, we may still live, but when the brain stops working, it is the death of the person. That is why brain care is the most important we can do for ourselves. We will discuss the top 7 supplements you can use to improve brain function and maintain a healthy brain for as long as possible.
The first most evident supplement for the brain is the omega-3 fatty acids. Omega-3 is in the composition of nerve cell membranes, so crucial for brain development, which is essential for nerve cell function and communication. And it also has an anti-inflammatory action. And this inflammation is a leading problem in cases of neurodegenerative diseases, like Alzheimer and dementias. And third, omega-3 is crucial for neural development and for connections between brain cells, a process collectively called neurogenesis, and we see it as improved brain function like memory, thinking, and other cognitive functions. Studies consistently show that high intake of omega-3, especially DHA, correlates with better memory and learning ability, and that is why omega-3 is commonly recommended among children. Omega-3 fatty acids can slow the progression of diseases like Alzheimer's by reducing neuroinflammation and supporting neuronal health. And it is important for the population after 40 to preserve brain function later in life. Regular intake of omega-3 is also associated with a lower risk of cardiovascular disease. Omega-3 is considered safe, but an important limitation is if a person takes blood thinners. A high dosage of omega-3 can increase the risk of bleeding, and otherwise omega-3 is considered very safe, even for long-term intake. Many guidelines advise omega-3 fatty acids, EPA, and DHA combined around 1000 milligrams daily. 3 to 6 months is typically needed to observe measurable cognitive or mood benefits and consistent. Long-term intake is encouraged for sustained neuroprotection and health benefits. For best absorption, it is better to take omega-3 with fatty foods rather than on an empty stomach. The second most important supplement for the brain is vitamin D. It is the most deficient vitamin in the world, and vitamin D is crucial for neuron growth, survival and repair, and also for the normal function of the immune system and calcium metabolism. Low vitamin D is associated with cognitive decline and Alzheimer's disease risks, and vitamin D deficiency is associated with depression, and vitamin D improves blood circulation in the brain. The optimal maintenance dosage of vitamin D is around 800 international units, but for brain benefits, 1000 to 2000 international units are used for 3 to 6 months. Vitamin D is fat soluble, meaning its absorption improves when taken with a meal containing healthy fats. The third supplement is vitamin B12. It is essential for the synthesis and maintenance of the myelin sheath, a protective covering around nerve fibers, and it is crucial for normal brain and nerve function. B12 acts as a cofactor in the conversion of homocysteine to methionine, and elevated homocysteine is associated with neurotoxicity and vascular damage. Vitamin B12 is critical for DNA and RNA synthesis and is involved in methylation reactions that regulate gene expression, a process that is crucial for neuronal growth, repair, and overall brain function, influencing cognitive performance and memory.
Have shown that adequate B12 levels are associated with better cognitive performance, and deficiency may accelerate age-related cognitive decline, leading to memory loss and impaired executive function. Sustained B12 is water soluble and is generally considered safe, even at doses higher than the daily recommended amount. The recommended daily dosage of B12 is 2.4 micrograms daily, but be careful with B12 because in high doses it can increase the risk of lung cancer, especially when taken with B6 vitamin. Usually B12 is taken for 3 to 6 months, and if there is a specific condition, continuous intake can be indicated. Vitamin B12 is best taken with food, as the presence of gastric acid and intrinsic factor, when not compromised, aids in its absorption, and for individuals with impaired absorption, alternate methods like sublingual supplements or injections may be more effective.
The fourth important supplement is curcumin. It reduces inflammatory cytokine synthesis and it protects the brain from chronic inflammation and neurodegeneration. Also, curcumin is a strong antioxidant, and curcumin has been shown to inhibit the aggregation of amyloid, beta, plaques, and tau proteins, which are crucial for Alzheimer's disease. So it has some protective role from age-related cognitive decline. That studies have demonstrated that curcumin can reduce amyloid, beta plaque formation, and tau pathology, suggesting a potential role in slowing the progression of Alzheimer's disease. Research indicates that curcumin supplementation can improve memory performance, and evidence from clinical trials suggests that curcumin may have antidepressant effects. Its influence on neurotrophic factors and inflammatory mediators could contribute to mood stabilization and overall mental well-being. In experimental studies, there is some evidence that curcumin may have anti-cancer action. Standard dosage of curcumin is 500 to 2000 milligrams daily. Due to curcumin poor bioavailability, it is commonly formulated with piperine or liposomal or nanoparticle delivery systems for improved absorption. Common intake regimen of curcumin is around 3 months. Since curcumin is fat soluble, taking it with a meal that contains healthy fats such as avocado, nuts, or olive oil can enhance its absorption and overall bioavailability.
The fifth beneficial supplement is Citicoline. Citicoline is a precursor for acetylcholine, which is an important neurotransmitter for memory, learning, and focus. Also, Citicoline promotes the synthesis of phospholipids, which is important for neuronal membrane repair, especially after injury or post-stroke repair. Multiple clinical studies have found that Citicoline enhances memory, learning, and cognitive performance, and it also improves focus and attention. Its ability to enhance phospholipid synthesis and support mitochondrial function provides protection against various forms of neuronal stress and injury. Citicoline is generally safe. Clinical studies and expert recommendations typically use a dosage range of 500 to 2000 milligrams per day. For cognitive enhancement and stroke recovery, doses around 1000 milligrams per day, often split into 2 doses, are common. Typical intake is 3 months. Continuous intake is also possible in case of brain injury. Citicoline is water-soluble and well absorbed on an empty stomach. However, some individuals may experience minor stomach upset, and if that occurs, taking it with a light meal is acceptable. In general, personal tolerance should guide whether you take it with or without food. Also, there are several interesting supplements such as Bacopa Monnieri, which enhances memory and reduces anxiety, is safe, natural, and proven effective over centuries. Phosphatidylserine improves memory and slows cognitive decline. Supports cell structure, reduces stress, and has excellent long-term safety. Another is Creatine, which boosts cognitive performance, particularly under stress or sleep deprivation, is exceptionally safe long-term, providing direct brain energy. And lion's mane mushroom supports nerve regeneration, improves processing speed, reduces anxiety, and is safe with anti-cancer potential.